Hello viewers, welcome to Addis Media Network, Addis TV English Weekly program. In today's episode, we do have a guest from John Hopkins University Ethiopia Addis Ababa branch. He is Simon Heliso, country representative and the chief of party. We're going to raise a lot of issues, including the spread of COVID-19 and the corrective measures taken by the university. Stay tuned with Addis Television. First of all, I would like to say thank you for your cooperation and for the time you have given for us. Could you please start from introducing yourself for our audiences, including your organization you are working for?
Okay, thank you. My name is Simon Heliso. I am the country representative for Johns Hopkins University Center for Communications.
Right. So what is the objective and the responsibilities of the Johns Hopkins University here in Ethiopia?
The university itself has several programs with many tertiary organizations in Ethiopia, training institutions, universities in Ethiopia. But our particular center for communication programs, we really aspire to provide thought leadership in social and behavior change communication, particularly in health. We also do a lot of capacity training for the public health sector, and also we do a bit of research and evaluation work, mainly for the purpose of design and development of communication programs in the country.
Right. So what are the major areas you are working here in Ethiopia?
We have at the moment about 4 major programs supported by the United States International Development, USAID, various chapters of the USAID, mainly in reproductive and maternal health, child health, family planning, WASH, nutrition, tuberculosis, PMTCT, and the like, malaria as well. We also have a global health security agenda program supported by USAID again with the National One Health Steering Committee, mainly working around zoonotic diseases, 5 major zoonotic diseases in the country. We also have a COVID-19 program at the moment, emergency response program related to COVID-19 prevention. And currently we've just got a new grant from the Office of Disaster Assistance to work with COVID-19 responses in internally displaced people's areas as well.
Great. What are the significant role you have played so far in connection with COVID-19?
Before COVID-19, actually, I need to mention about the other programs, the health programs that we've been working in the country. Mainly, we create mass communication, mass media-based programs, especially for social and behavior change in the country. We believe social and behavior change is the next frontier in development, particularly in the health sector. Therefore, we developed a radio-based mass communication program that actually ran for about 3 years now in 5 different languages that combines drama as well as reality component in Afan Oromo, in Amharic, in Tigrinya, in Walaitato and Sidamo Afu. These are the 5 major programs that we're working with. We also have various video programs that are related to maternal and child health and malaria that are working on around these languages and communities as well. We also created a community engagement platform. This is one of the social and behavior change interventions that we do that engages the community in learning from each other. We created roadshows, for example. We created bazaars. Bazaars are not very common in health sector, but we created bazaars that people can come and talk to each other and learn from each other. We also created pioneering mobile health application program that you can download from internet, again focusing on the life cycle of especially adolescent women up to 45 years of age during the childbearing age, basically. So those are the various interventions and activities that we've been doing in health areas. We carried that forward when we are working currently with COVID-19. We work very closely with the federal as well as regional risk communication and community engagement frameworks of the Emergency Operations Center, and we provide technical assistance for all of the communication program that has been ongoing so far. For example, the combat program currently, we do provide a lot of technical assistance. The communication message that come from are part of the things that we have supported the EOC in designing. Apart from the technical assistance, we also designed lots of materials, TV spots, radio spots, first for the general population, mainly focusing on prevention methods, but also addressing rumors and misconceptions, as well as the stigma around COVID-19. We also have messages that we developed for several sections of the community, for example, the religious leaders, so that they can help their adherents in responding to this epidemic, basically. At the moment, we also focus on capacity strengthening especially frontline health workers, as well as media professionals. We've been training all across the country, especially media professionals and government communications persons, so that they can present the right messages throughout the country. We also design programs for long distance drivers, so that they can protect themselves as they go about working their normal duties. As the government has also now decided for staff to come back after a bit of the close-out period, we also design messages for workplaces as well. That includes large industrial establishments, as well as normal offices and workplaces like that. We've designed message for hotels and hotel owners and hotel staff and management, so that they can protect themselves as well as their clients. We work with several other organizations in the country. In the various messages and materials that we have developed, we believe together with the partners that we're working with, we might have reached more than half of the country's population in several interventions.
Do you have any challenges you have been facing so far?
As I said earlier, we work very closely with the government system, the public health system at the federal level as well as regional level. We don't have any issues around that. The main problem, especially when it comes to COVID, is funding. That's the main problem. As you know, COVID-19 is not just affecting developing countries, but also affecting even major economies in the world. Our main funding comes from the United States government, and as you know, US is one of the countries that have been affected. Although they have come initially and swiftly, we also understand that other donors also have to struggle from their own issues as before they come to us. And that's particularly why in countries such as ours, we need to be resourceful in using whatever is available, and also mobilizing whatever is locally possible to address. Yeah.
As you have said, this university is established in Ethiopia before 15 years ago. So what kind of relevance or benefit it had for the city residents, for the capital city, as well for the nation at wide?
We've been working in the country for about 15 years. Initially, mainly in HIV/AIDS response. I think the kind of mobilization that has been done in HIV/AIDS is very clear and on. Over the last 5 years, we've been working with much wider health areas, and therefore we try to provide thought leadership for social and behavior change. As I said earlier, this is the next frontier in development. We've done a lot, but we need to change people's minds, people's hearts, people's actions, so that development actually sticks in and supports the human being. That's where we're trying to do. In terms of COVID-19, I think over the last 3 or 4 months, the level of awareness that we were able to achieve is very, very high. There are several studies that already indicate the level of awareness that is created is very, very high. People know what COVID-19 is. People know how it is transmitted. People know what are the prevention methods. That has been achieved in very, very short period of time, and I think that's one. In Addis Ababa itself, we have been supporting the Addis Ababa Public Health Bureau. We trained about 1,000 urban community health workers, frontline workers really, on addressing COVID-19 issues in the city. We have been working with the city bus, for example, authority. On each station we were able to present materials that people can read on how to prevent themselves from the epidemic, basically. We work with Ethiopian Airlines, we work with hotels in Addis Ababa so that they can train their own staff as well as their guests in how to take care from this disease, basically. So the other messages also, the radio messages that we were able to put out, of course, Addis Ababa residents can use, but these are the specific things that we've been doing in Addis Ababa. We work directly with religious leaders. I think you already are witnesses how religious leaders responded to the situation. Luckily, we were able to change where adherents going to mosques or churches so that people get yes, religious support, but not necessarily in the way it used to be. That was achieved by a huge advocacy work that we were able to do with the Ministry of Health and even senior government officials around the issue. Thank you.
Finally, anything you'd like to say for those who are watching this program via this media network at this television English weekly program?
A couple. For the community, as I said earlier, the awareness level is very, very high. But in terms of actually transferring that awareness into action and actual prevention of themselves and their family from this disease is very, very low. I just want to say action starts with the first move, action that you need to take. You need to take that step. It is necessary that we keep it up for our sake as well as for the sake of our families and colleagues that we're working with. We already know what are the prevention methods. There are several things that we need to do to prevent ourselves, and we already know. So we see a lot of let up, even simple things like using masks. You don't need to necessarily buy medical masks. There is possibility of using masks that are produced locally. Even if the masks are not available, you can use other local things that we already use. We can wrap around our mouths and all so that we can prevent ourselves. Take that step, please. It is necessary to prevent your family, yourself. That's the one thing that we need to say to the community. But for my main message is really for other actors. There are several actors, ourselves being one, but media, for example, all of the institutions that are working. Behavior changes at the moment necessary. Awareness is enough. We have done a lot around that. What we need to move is creating behavior change. And behavior change doesn't come only the individual trying. We need to support the individual. We need to support the community. We need to support at institutional level as well as policy level. So I'm basically appealing to actors to move to that level. Don't expect people to change overnight. It takes time, but we need to support that. For example, each and every person can support another person that is being facing a struggle due to COVID-19. Share your meal. We have that program already announced at government level. Do that so that people can say, hey, I need to also take care of the other person. In institutions, we see a lot of let up, for example, in let's say taxi stations or bus stations. The hand washing stations are not working at the moment. We cannot do that at this point in time. The disease is spreading even higher, and we cannot let up. Institutional measures. All offices, government offices or private organizations, they need to protect their staff. Without staff, we cannot do much. So that is institutional level that we start supporting everybody so that behavior change actually comes gradually. We need to continue emphasizing those kind of, the measures seem difficult, but they are not impossible. They are doable. Including those that require a bit of resources. I think it is necessary to reallocate whatever resources that we may have towards this effort. 6 months already, our children have not been going to school. Imagine another 6 months not going back to school. What kind of children are we going to have? So whatever resources that they are, we need to allocate and really defeat this disease as much as necessary. Otherwise, whatever we are facing is not just an ordinary disease. It's a problem that can debilitate the whole country, and that we cannot allow. That's what I want to say to all actors, including government, donors, and all other institutions, private or public.
Well, viewers, this concludes the program I have produced in connection with the spread of COVID-19 and other health issues with Simon Heliso, country representative and the chief of party at Johns Hopkins University here in Ethiopia, Addis Ababa branch. Until I come yet with another issue next time with another guest, stay tuned with other programs of Addis Media Network, Addis Television. I am Wegayehu, Muluneh host. Thank you very much. Stay tuned.